So I was given the title Animal Care and Biosecurity. Is there a crossover? And had a call with Jim and Katie to kind of talk about, well, what exactly are you looking for as far as the message? So thinking about, well, how do these two things kind of tie together? So if you look at the definition of the word care, I think, and I put in there, it said someone or something, I just put in animals, but provision of what is necessary for the health, welfare, maintenance, and protection of animals, okay, or people, or whatever you want to put in there. And so I thought, well, what is the mission of this council? I don't know a lot about this council, and it, it looks at the handling and care of livestock. And another thing I thought was kind of neat is the developing resources and educational materials for distribution. So we're not going to develop them, but we have a whole lot of resources at our Center for Food Security and Public Health at Iowa State that I want to share with you and use the network to get that out. Yesterday I was in a meeting that they talked about biosecurity for horses, and we spend a lot on cattle and pigs and poultry at our site, but don't have a ton on horses. And so I found NIAA's Facebook site, and they had the link up there, and I put it on my page, and it's been shared 17 times from my page alone. So there's a lot of people that want this information out there, and Iowa State doesn't have a marketing manager. We don't have a sales budget, so we appreciate any way we can get information out that are educational materials on different topics. So protection, keep that word in mind. Biosecurity. Okay, so what is biosecurity? Procedures intended to protect humans or animals against disease or harmful biological agents. So it's that protection word. And so my challenge is to make sure we're tying these two things together. So I look at biosecurity as insurance, right? It's a premium. How many of you guys enjoy paying your healthcare premium every single month? It's lovely, isn't it? I have a master's in public health, and one of our classes was the U.S. healthcare system. I was like, oh my God, I was so depressed by the end of that class. But anyway, so we think about premiums, right? And it's hard to put a value on its effectiveness. My PhD, I was always the dairy person that made everybody wear boots and clean them up, right? And they're like, oh, she's riding with us again. I guess I better have a bucket. And so, but I always talk to my producers about biosecurity, and they're like, well, prove it. Okay, so that's what I did for my PhD, was I went out and I looked at biosecurity performance standards on these dairy operations and said, does it make a difference with somatic cell count? Does it make a difference with production? And the answer was yes. Because people who care and do these things every single day have healthier animals. Healthier animals produce more, right? So but it's hard to put a measure on. It's a very hard thing to put a dollar and cents on. And it's one thing we hope we never need. I just saw Dr. Dennis Hughes in the hallway, and he said, how's all the secure food supply stuff going, Danelle? And I said, it's great. I said, but people ask me what I do, and I say, I hope you never know. Right? Because what we do on emergency response planning and some of these biosecurity things, you hope you never need it, but we do, unfortunately. So a good colleague, friend of mine, Dr. Tim Goldsmith at the University of Minnesota, we were at a meeting a couple weeks ago, and he made this statement, because when we talk about biosecurity, and then we talk about foreign animal diseases, and my boss, Dr. Jim Roth, gave a presentation yesterday that said, wow, in a foreign animal disease, it's kind of hard to have the best biosecurity when you're going up against no immunity in these animals and high levels of virus shedding. That's a challenge. And in some cases, if we're going to live through some of these diseases, and I never thought about it when Katie gave her presentation on equine biosecurity yesterday, and then Dr. Fly gave one on EHV, that there's no indemnity in the equine industry. I never thought about that. But biosecurity, if you're spending money on the front end, you may not have to rely on an indemnity check later on, right? Because you're still there. The poultry operations that did not go down from HPAI made some money last year, because egg prices went up on the layer side. So there's different ways to come at this. But animal care and biosecurity, is there a crossover? I think there is. So if we're keeping diseases out, that means we've got healthy animals and healthy people, right? Ever heard of the term zoonotic diseases? Right? So we want to make sure that those people that are caring for those animals are able to come to work every single day. When you put those two things together, we've got a safe and wholesome food for millions and millions of people in this country and overseas. And it's also a livelihood for our producers. And so, my whole message is animal agriculture is alive and well when you take these two things together, thinking about the animal care and preventing disease up front. So whether you're furred, feathered, hairy, or bare, we're going to talk through some prevention practices. So we developed this program at Iowa State back in 2004, and it's called Biological Risk Management. FAO is kind of who came up with this term, but it's different than biosecurity in a way, in that we recognize that you cannot get rid of all disease risk. It's not possible. But there are things we can do for the animal and for its environment to decrease that infectious burden. So we looked at it and said, well, that makes sense. Plus, when I go out and I talk to dairy producers and I say biosecurity, sometimes I get this response. They're like, well, that's a pig and poultry thing, right? Well, yeah, they raise their animals indoors and they have a different level of risk, but it's for everybody. You know, biological risk management, they get risk management from a cropping standpoint, right? Because they're managing risk all the time. So let's think about it from a biological standpoint. And I think the biggest thing, I'll show you some of our resources, is we look at the two-legged and the four-legged. I have Michelle in the room, right? So two-legged in that regard is the feathered, but the two-legged people. How many of you guys have ever worked at a job with another human being? Show of hands. Right? What happens when they don't show up? You're affected by that. So whether it's illness or a family member is sick or whatever, so trying to make sure that we're looking at a biosecurity approach that's keeping the two-leggeds as healthy as the four-leggeds. So what is biological risk management? It's the process of awareness education, making people think a little differently about their operation, going over an evaluation, and then managing that risk. So this program works for foreign animal diseases or domestic diseases, because it looks at how diseases are spread. So we've got some online tools that we'll share with you. So what are the components? Dr. Brian McCluskey, epidemiologist with SIA, who's now moving into a very new cool job, talked about HACCP approach, and that's kind of what this is it looks at disease risk management through a risk assessment approach. So risk perception, our materials don't look at disease specifics with the risk assessment, it looks at how diseases are spread, and finally management and then communication. And overall, this is one of my vet students from years and years ago on a dairy operation, and as they're going through these questions with these producers, you'll ask a question and they might say yes, and the next one they might say no, and pretty soon they're looking at their own shoes saying no, feeling kind of bad about stuff. And we said, look, it's not right or wrong. It's your risk, right? We've identified hazards that could negatively impact your operation if conditions were right. Doesn't mean all of them are bad. But each of our questions is designed that if you're doing that prevention practice, you'll answer yes. And so it makes programming a whole lot easier. And it's teaching them. And one of the dairy questions is, you know, do you pull calves from moms as soon as possible and get colostrum in front of those babies? You know, that if they don't, right, they know right away what the standard recommendation is. So awareness education is what's behind all of this. All right, so one of those first things is risk perception. How many seatbelt wearers do we have in the room? Okay, not everybody, right? If you ask my husband and myself, he'll say when the kids are with me, I wear it. Right? When they're not, that's his perception of risk. I've been in 2 totaled car wrecks in my life. I love my seatbelt. We have a different perception of risk. So factors that influence our perception, and that's where we start with livestock producers. Where are you coming from, right? Have you experienced an avian influenza outbreak, or were you next to a farm that did? Are we investigating for TB or the neighboring herd? Have you been through a BVD? Have you been through PEDV? Some of those things will really shape people's acceptance and tolerance. And so the training materials that we've developed kind of make it such that you keep that producer's perception of risk in mind. Because as we all know, we talk about human perception, right? My husband wears a seatbelt with kids in the car. And I'll get in and it'll beep. And I tell him that's me saying, honey, I love you, buckle up. Honey, I love you, buckle up. You know, he tunes me out on a regular basis. So the next step is risk assessment. So this is the hazard identification. We're looking at strengths and weaknesses for these operations. We know that's going to change over time, right? Farms get bigger, farms get smaller. This evaluation needs to be done on a fairly regular basis. And we know disease prediction is complicated. They show models all the time, right? Dr. Thurman, I sat in his, and he's like, every model's wrong, and some are less wrong. Okay, well, we know that. But what we know about disease risks, we can manage a lot of that, right? Vulnerability to disease, everything you needed to know, you learned by kindergarten, right? 3 square meals a day, a nap, snacks, outside playtime, and looking both ways before you cross the street. It's no different for our livestock, right? Cleanliness, immunity. Well, yeah, washing your hands. I forgot that. Don't tell my public health instructors. So things that we can really manage. So it looks through these types of risks. So how do organisms enter a farm? Animals and animal products, the biggest font, the biggest risk, right? But there's all different ways that things can come in. So it will evaluate these different risk areas. All right, so we talked about from a risk management standpoint, how do we get our arms around this? And so we look at routes of disease transmission, but a little bit more important is exposure of that animal or that human. So, sorry, the almighty dairy cow, for all the non-dairy people in the room. So we think about how pathogens either get into or out of an animal, right? The list is pretty long. When you think about how we might be exposed to animal diseases as a human, those are all the things with the boxes around them, the zoonotic risks. So in veterinary school, I learned a lot of the ologies, the virology, the microbiology, the parasitology. And we tell vet students, we teach you a foreign language for 4 years. And then we send you out to talk to people that have never had all those ologies, right? They never want to hear Karen write bovine pleural pneumonia. No, we don't really say that word. So how do we help our students, communicate some of these disease risks with their clients? And this is kind of the message behind it. So we'll talk about that. Diseases are spread a couple different ways, right? Between animals and humans. You have to have exposure. And in order to get your arms around that, to gain control, you have to understand how diseases are spread. But the cool thing is, 6 incredible ways, right? You can take the Merck Veterinary Manual and sit down and look at every single disease in there and figure out which one of these ways an animal can be exposed. So, aerosol, right? Breathing it in, direct contact. Fomites, which is a contaminated inanimate object, so everybody that touched that door handle coming in, right? And that gentleman just coughed, right? Don't touch the doorway on your way out. Oral, right? Consumption of contaminated products. Vector, that's probably the hardest one we deal with in the livestock industry to control, is the vector-borne, the bug-borne diseases. And then zoonotics. Zoonotics not bolded, not because it's not important, but how do things get into humanoids? Well, think about this. Almighty dairy cow, okay? So we breathe it in. We get stung by a mosquito that's carrying who knows what now, right? West Nile virus maybe. Fomites, so we're pulling calves and we're dealing with the materials after that. Direct contact, oral, drinking unpasteurized milk. So again, these are the zoonotic disease risks that this set of training materials goes over and how to prevent them. So just a couple that we pulled out. So direct contact, what is it? You got to have an open wound, mucous membrane, skin, blood sharing, saliva sharing. Reproductive transmission fits under this. So how do we control direct contact? We'll talk about that. Fomites. So people sometimes fall under that. Have you ever met an inanimate human? Some of them lecture in veterinary school, I tell you. Yeah. And then the next step. Okay. So we want to talk about these inanimate objects, and when you think about a farm and a dairy farm, if you've ever been on a dairy farm, there's inanimate objects everywhere, and we stick them onto cows several times a day to milk them. So how do you manage that? So we talk about the people side of it. I have a little kid in a stroller. When they look at disease outbreaks related to petting zoos or animals in public places, strollers, sippy cups, and passies, the little pacifiers, are one of the biggest risks. Right? Because they always say, like, the first kid, it hits the floor and you pick it up and you're sanitizing the heck out of it. And by the third kid, you're like, here you go. So, again, a risk area, these are the fomites that we try to manage. And it was mentioned earlier about some of the farm days to try and get consuming public onto our operations. It's great. I want people to do it, but I want them to do it safely so that public health is not investigating an E. coli or anything like that afterwards. So we've got materials related to that as well. So how do we prevent direct contact and fomite in animals? Isolation of sick animals, keeping equipment in the environment clean, testing our breeding males for disease, clean gloves, clean footwear. Okay. We think about going to work with babies on an operation. Do you do anything? If you're going to a human hospital and I showed up in my cow clothes, they're not going to let me into a nursery. But why do we do it on a dairy farm? So just getting people to think a little bit differently about these risks. Okay, so the two-leggeds working on these farms. How do we prevent their disease risk? I had a classmate who almost didn't make our 10-year class reunion because his little boy was in the hospital due to E. coli, HUS, hemolytic uremic syndrome. And it came from Dad, because he came home and he dropped his coveralls and he had a little kid crawling around the house. And, we don't always think about that. And it's trying to get people to think about how do you manage your clothing, your footwear, and all of that to not put them at risk. Gloves, right? We don't wear gloves with every single animal, but if I got cuts on my hand, and when I was in practice I had a lot of those, you want to wear gloves to protect yourself when you're working with suspect animals. This is my daughter who loves to play with palpation sleeves, so they're kind of big on her. But washing hands, getting people to think about that. Oral transmission, hand-to-mouth activities. Okay, I mentioned those sippy cups and the pacifiers. But from an animal standpoint, on the ruminant side, we worry about ruminant proteins going in from a BSE standpoint. But contaminated feed and water, our treatment equipment, how are we using that? How are we cleaning that up? So a lot of the animal care recommendations are available in this tool. Okay, again, separation of sick from healthy, keeping equipment clean and dry. This is not news, people, but it's stuff people sometimes forget about. So that's what the tool does, is it brings you through a lot of these different risk areas. So, don't drink water in lakes, streams, pools, and hot tubs. Big recommendation there for people. So, all right. So risk communication. This is the fun part of it. So you've done the perception part, you've done the assessment. Now, how do you get that information out? Well, in order for things to be effective, it's got to be understood. And so this information is presented in a producer-friendly speak, to making sure that we're not using crazy big words, that we're getting it down to, this is spread orally. So if you can prevent it orally, the animal shouldn't be at risk. So we've got a lot of resources for what we call peacetime. So today, right, we're not dealing with a high-path avian influenza or any type of other foreign animal disease outbreak. But we do have outbreak biosecurity, and our goal with our center of any materials that we develop and put on our website is we want you out there using them and telling your friends about them and making them available. We don't want you to spend time creating things. So our main website is the CFSPH. We have an infection control section. You can see it for cattle, equine, swine, vet clinics. A lot of different information is available there. Got some biosecurity posters that we just released, and so USDA funded these, but they're done in partnership with National Milk Producers Federation, the National Cattlemen's Beef Association, and the American Association of Bovine Practitioners. So these are they're designed to be like an 11 by 17 poster, laminated, and they're on our website. You can download them, you can have them printed. They're not really copyrighted. We want them out there. We don't have a big stash at home to send with you, but we do them in English and Spanish for beef, dairy, and swine. So I've got examples up here. And just kind of circulate a couple of them just so you can kind of see what they're like. We are fortunate to have a Spanish-speaking veterinarian at our center, and so they'll. So a lot of it is just because of the differences in how animal activities happen or animal introductions happen. So if you go to this website, preventingdisease.org, this is a free online risk assessment tool. It's kind of what I've been leading up to. Again, mentioned we developed it in 2004. We all know with smartphones we want everything mobile. So thanks to the generosity of Boehringer Ingelheim, they funded us to update the software and we did a huge content update and a user-friendliness update, you might say. But there's a ton of resources available through this without even logging into the site. But you can evaluate beef or dairy operations on this website. Big thing, whenever you hear a pharmaceutical company, you might wonder, well, did we use a lot of their resources on product recommendations? And we didn't. And it was a great relationship with BI. At being a public institution, I can't stand up here and endorse one thing over another. And so you'll see it in the homepage, Boehringer Ingelheim is recognized, but when you get into these materials, it's extension materials from all over. So we don't product endorse, we don't treatment endorse, because that's not our job. That's the job of the herd veterinarian that has the full understanding of that operation. But we give them the resources they need to help their farms advance. So again, the next set is just a bunch of different resources that are available on the site. The question about maybe a general farm statement, this might be one of them. If you have visitors that are contacting animals, we have different recommendations for them than the person just showing up from UPS, right? So we do have some general things, but these posters by and large are dairy, beef, or swine. So a lot of different signage. Again, safety. I always wanted to know this when I was on the dairies. Is there a bull in that pen? And sometimes I just need to run faster than you. We're going to be okay. So again, just some signs that are up, available on the website. Disinfection. So our number one download is this Disinfection 101 document. We don't teach a lot of disinfectant information in anybody's curriculum, right? We know a ton about antibiotics in vet school, but we don't know a ton about disinfectants. And so when you get into a challenge situation, this will really kind of take you through it, how to read a label, the different spectrums of activity. So a lot of resources available there. Again, on our main website, so we talked about foreign animal diseases and domestic diseases. We've got fact sheets for over 180 different diseases up there, written at a technical level, but we also have these fast facts. They're one-pagers written at about a 6th to 8th grade reading level on diseases. PowerPoints on a lot of things you can download and utilize. This is one of those fast facts, so even influenza. Just some simple questions that the general public tends to have. Foot and mouth disease. Okay, that's been a big focus of our center lately, and so we've got a pocket guide for feral swine, domestic swine. It's a flip book, lets you identify, lets producers understand what these diseases will look like. You can download a PDF for free off of our website, but we do have printed manuals available for purchase. And this was funded by USDA in partnership with American Association of Swine Veterinarians, National Pork Board, and our center. So, death by acronyms, right? And my phone rang one day, and it was Jamie Jonker saying, "How do we get this for cattle?" And I was like, it was Christmas for me that day, Jamie. You don't realize. So we did the swine one first, and we're really excited to work with Plum Island, and so they followed cattle through just like they did the pigs and what those lesions will look like. And so we've got this available as a PDF on our website as well as a wall chart. So we'd mentioned early on domestic diseases and what happens if a big, bad, ugly comes. And so the secure milk supply and the secure pork supply, and by the end of this year you'll have a secure beef supply website as well. But we've got a lot of biosecurity recommendations for what would happen in the event of a foot and mouth disease outbreak, or in the case of swine, classical swine fever or African swine fever. And not to forget our feathered friends, right? So there's a lot of poultry biosecurity information out there. Our group was heavily involved in the creation of these training materials per request of USDA. So English and Spanish videos, biosecurity officer manual, checklists, handouts, all of that kind of stuff is available at poultrybiosecurity.org.